Once you've figured out when to enroll in Medicare, the next thing is how to do the actual enrollment itself. So the first thing I have here is a link to a web page on Medicare.gov that explains this pretty well. I want to say it in my own words, just from my experiences, but this is a helpful page on the actual Medicare site. It also touches on when it starts, but we already covered that. But if you scroll down, you'll see different situations here and then different forms that they will guide you toward. But I'm going to cover all this in my words. So, first thing to cover, if you are getting Social Security retirement benefits, not disability benefits, not supplementary income benefits, Social Security retirement benefits before you're turning 60, before your 65th birthday, then you're going to be enrolled in Medicare Part A and Part B automatically. And if you want to enroll at 65, great, it saves you a step, but you can also decline it if that's more appropriate for you, if you are getting health insurance from a large company. So that's the only situation where this stuff is automatic. For every other situation, if you're not getting those retirement benefits, then you're going to need to enroll in Medicare manually. So I don't mean to scare you away with saying manual. It's not that complicated, but you have to take action on your own behalf. So if you're enrolling at 65, you're going to enroll in Part A and Part B at the same time. This is very easy. It rarely has any issues. Do it online. The online application is simple. It takes maybe 5-10 minutes, and I'll show you kind of the first steps without having to log in or anything. You can also call Social Security or go to your local office. I don't recommend doing that if you're signing up for both A and B at 65. It's just unnecessary. So this is the link, and I've got it in the guide. I just clicked it. Sign up for Medicare. This first link here, apply online. And then it's got a disclaimer here, terms of service. I'll just click the box and just show you a little bit more. So this is the page. Technically, it's the page for applying for Social Security retirement benefits or just Medicare or both. Most of my clients are just enrolling in Medicare. They're holding off on Social Security till a little bit later. So you'll click this button, start a new application. This is assuming you haven't started it yet, obviously. And then I'm applying for myself, or if you're helping somebody, you can click that option. They want you to create a My Social Security account if you don't have one. If I click no, then it's going to prompt me to create one. Do I have an address in the United States? Let's assume yes. All right, and now it's prompting me to create an account. And it's going to be a login.gov account, which is kind of their overall single sign-on for government services. So once you create that, then you'll start the application itself. And let me see if I can cheat a little bit and show you the first bit of the application. I guess I can't. Okay. Well, anyway, it's a very basic application. A couple questions like just confirming your name, your address, where you were born, Social Security number if you need to confirm that. You should have all that information in your head. So what happens then is it takes 1 to 2 weeks to process. You'll get your ID card in the mail. You'll get your first bill for Part B and some instructions on how to pay that, and your start date will be confirmed. You'll be good to go. If you are enrolling in Part A only at age 65, if you decide to delay Part B, then same steps that I just went over, do it online, and where it says, do you also want Part B, just say no, you just want Part A. Same process. You'll get the ID card. You won't get a bill for Part B, obviously, but your ID card will only have Part A on it for now. Once you enroll in Part B later, they'll send you a new one with the Part B date on it. But that's how to do only Part A. If you delay Part B or Part A and Part B, a couple things, a couple different routes here. If you just enrolled in Part A at 65 and you only need to get Part B, then I would suggest doing this online as well. You're going to need a form which is called CMSL 564. Basically, what this is, you're going to complete some of it. Your employer or your spouse's employer, wherever you get your health insurance, is going to complete some of it as well. This is proof that you had large employer health insurance and therefore were able to delay Part B without penalty. So it's what you got to provide to tell them that, hey, don't penalize me when I get ready to sign up for Part B. I'll show you what that looks like. I've got a link to it here, obviously. This is just a cover sheet. And then it's got some fields like the employer's name and address, the applicant's name, that's you, the employee's name, if you're the employee, also you. If it's your spouse, this is your spouse's information, name and social security number. And then information on the group health plan, the date the coverage began. So this is the first, not the first of the year, not the first of the year when your employer last switched insurance companies. The first day you had coverage, the first month you had coverage through the company. That's very important because that needs to be a date that's before your 65th birthday. So it shows, hey, I had that coverage before 65, therefore I was able to delay Part B up until this point. And then when did the employee work for the company? If they're still working, you just leave 2 blank and put in still employed. Pretty self-explanatory. And then the signature and title and information of the company official, usually an HR contact, a benefits contact. So once that is done, then you're going to upload that to the Part B application. And here's a link to it. I'll show you what that looks like. So obviously this is a page just for this situation. Click Start Application. And this is like a fillable PDF. A quick acknowledgement. And I'll just get this out of the way. And now, scroll down, and then we'll start entering our information. If you've already got a Medicare number because you got Part A, pop that in here. If you don't have a Medicare number, you can put in your social security number. That'll work fine. Yes, I want to sign up for Part B. Your information. A lot of this information is going to be the same as what's on that initial form that we just went over, so just make sure it says the same thing. This is important. This remark box, field 7, what you want to put in here is the desired coverage start date. So a good example is, say I'm retiring at the end of December and I need my Part B to start on January 1st. Say desired Part B start date, January 1st of whatever year it is. If you don't put that in here, what they'll do is they'll start your Part B the first of the month after they process this. So say I'm ahead of the curve. I filed this in October and I don't put that in here. I want it to start January 1st. They'll start it on November 1st, which can throw a wrench into some things. So make sure you put that in that box. And then this section B, it looks a lot like the first of that initial form, the employer information form. And then there's a section to upload that first form. It's called CMSL 564. Upload the completed one here. And just to be safe, you can attach a copy of your ID card from that coverage with your name and the start date on it. Can't hurt to give them that extra information as well. And then you sign it. You'll get an email to complete that e-signature process, and then you're done. Now, that takes anywhere from a couple weeks to a couple of months. It's a total crapshoot as far as, the Social Security Administration's workload. Unfortunately, there's nothing you can really do about it. You can check the progress of it online via your Social Security account, but that's why you want to get this done 3 months before your group coverage ends, just to allow for those delays. And if something needs to be corrected, then you have time to correct that and not have your coverage be delayed, hopefully. All right. The last situation we'll cover is if you delayed Part A and Part B at age 65, say you're retiring at 70 and you need to enroll in everything. I would not do it online. Technically, you can do it online, but I would not at this point. Um, I would do paper forms, and I would fax them, mail them, or walk them in to your local Social Security office, because you don't want the online process to hang up and just wait until the queue clears and then do the second part for Part B and then wonder while that queue clears if you did it all right. Get it in person or fax it to a local office so that they can tell you if everything looks good. So there are 3 forms to fill out. The first is that L564, which is the employment information. Hey, I had coverage from this date onward from the employer. The second one is CMS 18F5, which is the paper Part A application. And then the third is CMS 40B, which is the Part B application. So you don't need to be a pro and remember these numbers, but these are the 3 forms. And find your local Social Security office. There's a link here from ssncheck.org. I would use that and not the Social Security's website, because they hide contact information for local offices. This is a private site that actually shows the stuff. And call them up, confirm, hey, I'm applying for Part A and Part B. I've got all these forms. Do you want me to fax them or walk them in? Depending on the office, they may or may not take in-person appointments. They may prefer fax. They may prefer you to mail. Just check with them, because every office is different. I wish they were all uniform, but they're not. And then what I just explained is outlined here on this Medicare.gov page under this large section with this yellow cobra warning here. You can send completed forms to your local Social Security office by fax or mail, or you can walk them in by appointment. They don't want people to really know that, but offices in big cities usually have that capacity. All right. So that is how to enroll in Part A and Part B, depending on your situation. I know that's a lot. This is where a lot of people say, what, I tried to figure this out on my own. I'm done. I need help. People reach out to me when they're about at this point. And I can help you, depending on your situation, figure out exactly what to do. I'll help you prep everything. So feel free to reach out if you would like that. But this is everything you need to know on how to enroll with the Social Security Administration.